Good morning, everyone. My name is Kim Stevenson, and I'm Director of Workforce and Clinical Affairs at the Massachusetts Health and Hospital Association. I want to welcome you to today's Caring for the Caregiver webinar, Mental Health America's 2026 Bell Seal for Workplace Mental Health. This webinar is being recorded and will be posted on our Patient Care Link website, along with all other Caring for the Caregiver webinars. A few logistics before we start. If you have questions during the webinar, please enter them into the chat feature as we are in listen-only mode. The questions will come directly to us and we will do our best to address as many as we can at the end of the presentation. I also want to take a moment now to thank MHA's 2025 annual sponsors and strategic partners for their support in underwriting today's webinar. This is just one of many events we offer throughout the year to connect our members with leading experts to help address timely issues like the one today. I'm pleased to introduce our speaker from Mental Health America, Taylor Adams, Director of Workplace Mental Health. Taylor manages Mental Health America's workplace wellness initiatives. These include researching the annual state of employee mental health and well-being in the U.S., awarding best-in-class employers with the Bell Seal for Workplace Mental Health National Recognition Program, and developing evidence-based best practices that advance employee mental health and well-being. For more information, visit MHA's Workplace Wellness Resource Center. Thank you so much for being here today as we look forward to getting started in this discussion. Taylor, I'm handing it over to you to get us started.
Great. Thank you so much, Kim. I really appreciate you hosting me today and for everyone who's taking the time to join us. So yeah, you're going to hear Bell Seal a lot today. It's a really sweet and simple presentation about the program that I'd love to share with you today. And we can just launch into the first slide to talk a little bit about what we'll focus on. So we'll talk about some of the value and benefits of MHA's Bell Seal program. We'll talk about the application process for the upcoming season that opens January 26th. We actually just finalized all of our materials for the upcoming season like yesterday. So you're among the first group of people that are kind of hearing about some of the changes that we've made to this year's cycle. And then I'll share a little bit about the resources that we have to help prepare with application preparation, but also generally you can use to help support your workplace mental health efforts. So next slide. Before we get into the program itself, I wanted to share a little bit about Mental Health America and who we are. Mental Health America, or MHA, was founded in 1909, and we are the leading national nonprofit dedicated to promoting mental health, well-being, and illness prevention. Our national office is based in Alexandria, Virginia, but we do have 37 staff members and 143 affiliates nationwide. I'm actually an hour north of London, so it's about 4 p.m. my time, and it's already dark outside. But we do have just a wide range of folks from all over the world that support this organization. So our workplace wellness initiatives aim to educate and promote employer practices that are rooted in prevention and early intervention that holistically support employee mental health and well-being. And that is similar with a lot of our different programs in public education, advocacy at the state and federal level, and our workplace programs as well. So Mental Health America's Bell Seal Recognition Program was named after the mental health bell. So this is the image that you see on the screen. So this is a symbol of hope for mental health since 1953, when this bell was actually cast from the chains of individuals once locked in state hospitals. Pretty intense, but that just kind of shows just our history in advocacy, especially on behalf of individuals living with mental health or substance use conditions, throughout history since 1909. So that's a little bit about MHA, and then we'll shift into next slide about, generally speaking, the impact of work and well-being. I know a lot of you joining today already understand the importance of employee health and well-being as it relates to being your most productive, engaged, fulfilled at your position. But I'll share a little bit of the research and why we, conduct the workplace programs that we do. So according to our Mind the Workplace research, and this was the most recent one that we did back in 2024, most employees are reporting that work stress impacts the quality or amount of sleep that they have, and then also their relationships with family and friends. So 76% and 65% respectively. You've probably seen a lot of different reports that have come out recently from different sources that report similarly high rates. What is interesting here is that the degree varies greatly depending on the overall work health scores and work environment that the employee exists in. So for that first survey item around sleep, 97% of employees agreed that it affects their quality of sleep, work stress, in unhealthy workplaces compared to 44% in healthy workplaces. And then similarly, if you look at how work stress affects relationships, 88% in unhealthy work environments compared to 25%. So all this to say that there is a lot you can do as a business leader, as a mental health champion in your workplace to influence the impact that stress, mental health issues, concerns can have on your workforce and your peers. So next slide, that's kind of where we introduced this recognition program. Since 2019, MHA has recognized the nation's top employers committed to creating mentally healthy workplaces through its Bell Seal for Workplace Mental Health program. And this is led by MHA's rich history in research and advocacy. This Bell Seal program is a holistic evaluation of employer practices considering the entire employee experience. We could just shift to the next slide here. Employers earn Bell Seal recognition by meeting the national standards for best workplace mental health practices. And we look at four main sections that we'll talk about a lot today, but we focus on culture, benefits, compliance, and then whole health wellness programs. And to give you a snapshot of this year's cohort, so in 2025, MHA awarded 360 employers with Bell Seal recognition. This represented a combined workforce of over 4 million workers. It spanned 21 industries, and healthcare and social services industries represented 29% of all 2025 recipients. And then nonprofit organizations represented 19%. So you're in great company if you're here participating on this webinar in those industries. So this highly kind of reflects MHA's general audience when we do advocacy and public education work. But we created this framework and this program to be broadly applicable to different industries, but healthcare, social services, nonprofit is a big majority of those employers who do participate. And then we have representation in 40 states and the District of Columbia, including 7 Massachusetts-based employers. So honestly, I think we could get that number up. And if you are, you decide to participate in this program, you'd be among kind of in the top 10 of employers who've chosen to go through this evaluation and get recognized for their mental health efforts. At the bottom, and I believe there'll be follow-up with the handouts, but I do have a couple of links. If you're looking for anything related to the program, you just go to mhanational.org/best employers. That's where you'll find everything you'll need related to the program if you need to reference it or go back to it or find certain resources. So moving on to the next slide, I want to talk a little bit about why employers participate in the program. There's a lot of different benefits to it, and not just for the good of your workforce, but there are also some tangible benefits that we'll talk about in a little bit. But just generally speaking, the Bell Seal program is a really great way to strategically evaluate how your internal practices are aligning with best workplace mental health practices. So these are research informed evidence-based best practices that, before we were doing recognition programs and programming, we were doing research in this space over the last couple of decades. So it's a really good way to get a sense of where your organization is at. And so when I first joined Mental Health America, it's almost been 9 years. I started out in finance, and I remember the annual audit was like the most dreaded, the dreaded thing of this season. But I've heard employers describe this process as almost a self-audit of their workplace mental health practices. So it is thorough. It takes a lot of time, but it is well worth the effort to kind of see how you're aligning with some of the main drivers for good employee health and mental health and well-being. It's also an opportunity to benchmark your efforts against the national standards we've created, but also other employers. So like I mentioned, over almost half of the cohort from last year was in healthcare, social services, and nonprofit. So you can kind of see how you're comparing against some of your peers in the space. You will be recognized for your commitment to employee mental health. As I mentioned, I've been doing this for several years now, and I don't know if the work's ever gotten easier. If anything, I think it's gotten harder and a little bit more complicated as, you face different economic, political, just uncertainties. There's a pandemic, post-pandemic recovery, what's happening in the world today. So this world does continue to evolve and become more complicated. And people who choose to advocate for their coworkers or, champion mental health in the workplace, it's not an easy job, but it's one that's definitely should be recognized. So this program is another kind of opportunity to recognize for all the efforts that you're doing in this space. Um, Another aspect of this is you do join a community of business leaders who strive to create those mentally healthy workplaces. They're kind of this network of people having these similar conversations where you see a lot of information come out about like, here's the what to do to solve this for your employees. There's a lot of noise out there. But this is such a great group of employers that truly understand what it takes to create that mentally healthy workplace, and you join that community by participating in this program. And last but not least, we try to make the application process as easy as possible. I'm very familiar with some of those other recognition programs out there that get a little complicated. We really try to make this easier on the employer when they're, submitting applications so that you can focus more on your efforts and less on, the application process, right? And there is a little cost associated with it, which I'll talk about in more detail in just a little bit. So if we shift to the next slide. I want to talk a little bit about the criteria itself. I might be moving a little bit out of order, but just to give you a sense of what we're looking for when we evaluate organizations. I mentioned those four main sections that we look at. Um, it's a there's a lot of different areas that we're covering here. There's a lot that's jam-packed into it. And it could be overwhelming at first to see all the different things that we look for. But what I have found with employers who participate in the program, they work through these questions, is that they're doing a lot more than they expected to help support their employee mental health and well-being. There isn't a one size fits all solution to this. So there's a lot of different ways that you can be supporting employees that you never really maybe previously connected the dots on what's working and what's not working. So just as an overview, of where employers succeed when they're participating in this process. Bell Seal recipients with high scores for workplace culture, typically they understand their workforce's needs and respond with meaningful policy changes, improved benefits, additional support. So this could include things like having a strategic and responsive approach to measuring and addressing employees' mental health concerns. It could be around developing supportive and fair people leaders and managers, enforcing fair and transparent personnel policies. So anything from performance review to compensation to professional growth. There's a lot that's covered under this culture section. And then recipients with high scores for mental health benefits provide their employees and their families with comprehensive mental health benefits and recovery support, such as access to affordable, high quality, easy to navigate health insurance that covers behavioral health services, an employee assistance program that supplements but not replaces employee mental health support, and then paid disability benefits and adequate leave for recovery from mental health or substance use conditions. And I'll talk about a little bit. So even though we focus on all these different areas, they are weighted differently when we actually go to score. So I'll share a little bit about how that all plays out. But then the last two sections, so recipients with high scores in compliance and wellness commit to creating an inclusive work environment, including those who live with mental health or substance use conditions. They provide workers with the knowledge and confidence to understand their rights and request the appropriate support that they need. They also facilitate peer connection and offer things like remote work options, schedule flexibility, additional resources that help employees kind of balance their life and work priorities. So there's a lot of different things that we look at in those two sections as well. Shifting to the next slide here, I want to give you just a sample of what the questions actually look like on the application. So for the first question here, does the employer assist employees in accessing or navigating their health insurance and other benefits? And then we often include just some examples that we've seen from other employers in the past and what we're looking for when we ask these questions. So most of the questions on the application are yes or no. There's a few multiple choice, and then we have about, I think it's 8 or 9 open-ended questions where employers or applicants get the opportunity to really kind of provide context for what their workplace does, how they actually take a lot of these policies and put it into practice in their workplace. Um, I think the best piece of advice I could give when you're going through the application and you're not sure if you're meeting these items or not, you can always reach out to us directly, just workplace@mhanational.org, and we can, kind of walk you through what the activities that you're doing as a workplace qualify for that criterion. It's definitely better to do this before you actually go to submit, because it's just harder to adjust things after, we'll talk about all the process, but always reach out if you have a question about if you're meeting an item or not as part of this application. And then moving to the next slide, I want to share a little bit about how we do the scoring. So when you apply, our workplace wellness team conducts an evaluation using its proprietary scoring rubric that aligns with evidence-based best workplace mental health practices. So to give you an overview, it is broken into those 4 sections again. We weigh workplace culture at 30%, benefits at 20%, and then wellness and compliance at 25%. So the entire score will be out of 100. We put a little bit more emphasis on culture because we do have a few more questions that's included as part of that section. We also wanted to create a framework that was accessible to a lot of employers of all different sizes and industries. So you could be doing really well in compliance, wellness, and culture, and maybe not, for example, not be able to offer the most robust benefits package. But if you are doing well in these other areas, that will show in the overall score here. So you do need to meet a minimum of 65% to qualify. And then we have 4 recognition levels: bronze, silver, gold, and platinum. You get a score in 4 of those sections, and then you have your total score, and then that's what determines that recognition level. So at the bottom here, and I can share a link in the chat as well. When you go to submit the interest form, which is the very first step as part of this process, you'll receive access to what we call like our pre-survey. It's a completely optional tool, but if you're curious about this process, but you don't know if you're really ready to apply for the recognition piece, or you want to get access to the criteria, but for whatever reason, you can use the pre-survey as a tool to determine your potential recognition level and if you qualify at all for recognition. It is pretty accurate to when you go to complete the full application, but the results may vary depending on your responses there. But it is a good tool to get a sense if this is something you're interested in pursuing. And then for reference, our 2025 cohort of BELSA recipients achieved an average score of 89% out of 100. This was compared to 87% in 2024 and the same score in 2023. I actually was expecting scores to go down a little bit this year, and that was not the case. It actually increased from previous years. And what we have found year to year, again, we've been doing this since 2019, is that organizations who renew annually either maintain or increase their score from a previous year. And I'll talk about renewal in a bit as well. I think it's like fewer than 3% actually see a decrease in score. So I mean, that really excites me because I think this is something that employers kind of use to hold themselves accountable to maintaining that score and increasing and making progress in their efforts year after year. And most of them do. So shifting to the next slide, I want to give you an example of what the results look like. So when you actually go to apply, what do you receive at the end here? So after the evaluation, applicants will receive their results within 45 business days after submission. So that sounds like a lot. It's usually a lot sooner. And the earlier you submit an application, the sooner that you'll receive your results. We just give ourselves enough cushion because we actually manually review every application. We review all the responses that you give, and then put this report together for you. And with this report, it will show you how you did in each of those 4 sections that we discussed. You'll get a total score at the end. Sorry, I just lost my thing here. You'll get a total score at the end, and then at the top right corner, you'll see which of those 4 recognition levels you qualify for. On the second page, we show how your organization compares to, so we look at the pre-survey scores, kind of what does the average employer look like, and then how you compare to your recognition level cohort. So if you are recognized at gold, we'll look at the average score across all categories for gold level recipients of that. So that's just a sample PDF report and what you'll receive there. And then moving to the next slide, I want to share a little bit about more of the tangible benefits as part of the program. As much as I'd love to say it's just good business and goodwill to support employee mental health and well-being, there are some other benefits as part of this program. So all applicants do receive that evaluation PDF report. So even if you don't qualify, you will get that kind of breakdown of which the areas you did well and which areas you could use improvement, then how you scored compared to what you would need to reach recognition. If you are recognized at one of those 4 recognition levels, you also receive a promotion toolkit. This includes a digital badge and templates, several different templates for internal and external communication. So we try to make it as easy as possible for you to be able to promote your recognition once you receive that. We also recognize all of our recipients on our BellSeal website, as well as our annual workplace mental health report, which is based on the outcomes of that season's cohort. So this is the cover page of the report that we published back in August for this year's cohort. We include all of our recipients in an announcement during Mental Health Month in May, and then in that and in our annual conference, which takes place in October. And then all all recipients receive a digital certificate that you can print and display. That's new for this year. So we also have the option for a mailed certificate with a really nice metal seal that's included. So that's a slight additional cost just because it's a little costly to mail. But you have access to both. And then we enroll all our employers in a quarterly workplace wellness newsletter as well. So I didn't include it on the slide here, but there are kind of ad hoc opportunities that come up to help promote your recognition and some of the programs that you're doing. Just as an example, so we had 20 of our recipients featured in a workplace mental health toolkit that we published a couple of years ago. We had 12 recipients featured in this year's workplace mental health report. Several recipients have participated on webinars, panel discussions, in person, virtual, at our conference. And then we've had a couple involved in case studies. So it's not a guarantee as being part of this program, but if you have just a really interesting program that you're working on or writing a piece or a blog, we usually reach out and ask if you'd like to be featured as part of that opportunity. Okay, moving on to the next slide, getting into the nitty-gritty, and then we'll talk about the full process kind of start to finish. So there is a cost of once a year cost associated with the program. This just kind of covers our cost for doing the manual review and putting together a report for this. It does vary depending on the size of your organization, also industry. So we offer 25% discount for government and nonprofit organizations. It's free for all MHA affiliates, which that's part of that 143 affiliate network I had mentioned earlier. And then all other organizations have kind of their own price point there. So this is on that mhanational.org/best employers if you need to refer to it at any point. And we had slightly increased the price from like $30 to $50 this past year, but we had kept it the same for the last 4 years prior. So there should not be too much shift in this. And that is an annual fee if you want to maintain that recognition certification year after year. But there's no other costs associated outside of this application fee there. And then moving on to the next slide, let's talk about the process here. So first and foremost, the first thing you would do is submit an interest form. Access to everything will be through this form. And I can share the direct link in the chat in a second as well. When you submit an interest form, you will receive access to that pre-survey that I had talked about, which I highly encourage you to take. It's optional, but just so you can get a sense of where you fall. And then access to the 2026 BellSeal criteria. And this you can review in detail to kind of know what to expect on the full application. We actually just published the 2026 criteria like yesterday. So that's available now if you submit this form. We do have an application window, so we don't start accepting applications until January 26, 2026. But getting access to the criteria now, you can see what's involved. And then when you go to apply, it'll be the same thing, but you just submit it online. So then Once you submit that interest form, get access to those materials, you'll receive an email to the online application. This is what you'll actually submit when you want to apply in late January. So around that January 26th date, you'll get another follow-up email with the link to the actual online application. And then you would just prepare and submit your application by April 3rd, 2026 is our 2026 Bell Seal deadline. The application itself, when you go to submit and you were kind of preparing it in advance, should only take like 30 minutes to an hour to actually submit that. Most of the work will be in pulling the responses together in advance. So getting access to the criteria now gives you a little bit more wiggle room between now and April to pull all that together. The application has 37 multiple choice open-ended questions. A little misleading because there's quite a few that are multi-part questions, so maybe it's probably double that depending on how you respond to some of these questions there. We do not require documentation. However, it's really important that you answer questions, honestly and to the best of your knowledge when you go to submit. I had mentioned that there's 8 or 9 of those open-ended questions. This is really so important that you're putting a lot of the information about what does your organization uniquely do to support A, B, and C, for example. Like this is the best way to share kind of the narrative and the context about what your workplace does and really help strengthen your application overall, kind of in place of submitting documentation. And we do this because in the past, we've required a little bit of both, and submitting a handbook policy is not enough. That tells us nothing about what your workplace actually does this in practice. So that's why we've shifted more to that open-ended response model. But it does make it much easier when you go to submit. All you need are your responses, and you don't need to submit a bunch of documentation to be eligible. There is an option to submit supplemental documentation if you wish, but it's not required. And then you would pay the application fee at the time of submission. Their check payment's usually the easiest and fastest way of doing it, but we do have, or I'm sorry, credit card is the fastest and easiest way to do it, but we do have a check payment option. The only thing with that is we just need to receive payment before we can actually review the application, so it just may delay when you would receive those results. And then you'll receive your results by email within those 45 business days. Like I mentioned, we give ourselves a lot of cushion, and it's typically a lot sooner than that. I mean, usually within 15 business days, I'd say. And then just a couple other dates to remember. So we'll announce the 2026 cohort recipients during Mental Health Month in May 2026. We'll publish the Workplace Mental Health in 2026 report in summer. So that's usually around July and August, where you can kind of see the outcomes and some examples from other employers from your cohort that you applied with. And then we do have annual renewal is required between January and March 2027. So there's usually nothing you have to do on your end. We just will send some follow-up emails around that time to say, hey, if you want to, and this is actually new for this year, if you want to make any changes to your application, you just review your past submission, any new efforts you did in the last 12 months, make note of, and then you just submit. Similar timeline there. Okay, and then I think we're moving on to one of our last slides here. Some of the things that can help prepare your application. So I've already mentioned quite a few of these already. But please take the pre-survey to assess your organization's eligibility and potential recognition level. Sorry, I should have mentioned this earlier, but we do, and this is new for this year, but we do require a minimum of 15 employees to participate. Any organization who's applied in the past and received recognition, as well as any MHA affiliates, are exempt from that. But if you are new and you're applying for the first time, you do have to have a minimum of 15 employees to be considered. So then you can take this pre-survey, and that determines the potential recognition level. I would strongly recommend downloading our Workplace Mental Health in 2025 report. This has a lot of great just information, data, examples directly from our Bell Seal employers. We have a really good outline of what benefits you should offer along the mental health continuum, looking at it from a prevention to recovery support angle. We have a really good, it's like 9 different ways you can build a mental health strategy. There's just such great information as part of this report. So I encourage you to download that to see, especially as you're evaluating your own workplace and working through the application questions. What are we looking for at MHA to ensure you're meeting these criteria, but also what you could be doing as an employer, and probably get some ideas and inspiration from that. And then last but not least, we do have our Workplace Wellness Resource Center, and this is at mhanational.org/workplace. So this is a whole bunch of different information, both for employers and employees. It was designed for employers at different stages of their workplace wellness journey, so to speak. So if you're just starting out, or say you're really advanced and you have a strategy built around this, there's, resources for everything in between. And it was modeled after the Bell Seal framework. So if there's a question as part of Bell Seal in the application, and you're looking for resources or more information or examples from other employers, we'd likely have an article or something related to that in this Workplace Wellness Resource Center. It's also where we have all of our research. So our annual Mind the Workplace research reports, I think dated back to like 2016, are available. And then we have a couple of employer case studies that you can find there as well. So with all that, I will turn it over for any questions that you all have. Before we do that, can you just scroll to the very last slide? I think, okay. Just so I don't forget, here's just all the links in one place. All things Bell Seal will be mhanational.org/best employers. That Workplace Wellness Resource Center I just mentioned is just /workplace. And then if you have any questions, you just want to reach out to me directly, workplace@mhanational.org. Okay, with that, I'll turn it back to Kim.
Taylor, thank you so much. What a great presentation. And hopefully you'll see some applications for Massachusetts hospitals, I hope. If anyone has any questions, please feel free to enter them into the chat and we'll make sure to get to them. And just to kind of kick things off, I know you did touch a little bit on this in the presentation, but can you just kind of reiterate which application questions or areas should organizations be prioritizing as they complete their applications?
Yeah, absolutely. I'm really sorry. I hope you can't hear my pug snoring in the background. It got really loud the whole
No, I
like
can't.
10 minutes. He's so comfortable right now. It's very sweet. Um, in, in terms of prioritizing on the application, so I know I mentioned a couple times those open-ended areas. In terms of subject matter, so we're really big on what you're doing as an employer to ask for feedback and look for those potential structural or cultural issues that are contributing to employee health. So for example, if you're like, we just purchased this new employee assistance program or implemented this new wellness program, but there was no data, metrics, ask input from workers on that's what they're looking for, then there's a bit of a mismatch. So one, in terms of the culture section, um, kind of really looking into as an organization how you're tailoring those benefits to your workforce is really big. So we ask like, how have you asked for that feedback? Have you implemented a change? It doesn't matter how small, just did you listen to your employees and take an action as a result? And also we have a section that asks about strategy. And I think sometimes that can get a little bit like, oh, well, we don't have anything super robust like that, but just we have a bit of a checklist to be like, okay, are you making sure that there's opportunities for different levels of your organization to get involved? So, mental health champions, employee resource groups, affinity groups, HR, you're working with benefits team. So even if there isn't like a full-fledged, here's something written out in my handbook, or here's our mission statement, you can kind of put together the pieces of your strategy and, build the narrative around that. So the culture section, I think, is really key, and those open-ended areas are probably where the best areas to prioritize.
Excellent, thank you. And what happens if an organization applies but they don't qualify for some reason?
Yeah, so that does happen. Unfortunately, there's very few that happens to. That's why that pre-survey tool is really great because if you're like, well, we're way off, way off the mark than we were expected, then you don't have to invest all that time in the full application. You can really, a good place to start is use that as a framework to start building out some of those strategies.
Mhm.
But we do offer a lot of free resources through that resource center. MHA offers some services that whether that's soundboard sessions, there's different things that we can do depending on what the needs are. It could be directing you to the right training depending on what you're looking for. And then we have a lot of partners that do special works in different areas. So the best thing to do in that case is if you're like, well, I don't think we're ready for recognition, but we want to use this criteria as a bit of a launching point, we can help direct you in the right direction and try to find the right resource for the employer.
Great. And so if somebody does apply, they don't get the recognition because, something's missing. Is there feedback on their specific application, or do they get like any comments or summary back about, areas where they need to kind of, you know, ramp up a little bit of work or something, suggestions to help on the next round?
Yeah, so we can just schedule a quick call to go over those results in a little bit more detail. This is something we haven't launched yet, but it's kind of like a project in the making where we're going to it's almost like an extension of that sample report that I showed where we go into much more detail about where you explicitly did not make the marker or that you were doing really well in. And that includes some more detailed recommendations of like, here's a resource you can go to. Here's 3 actions you can take to address this. It's not something we've launched yet, and I don't have any like materials to share about it, but that is kind of like in the pipeline of things that we want to expand on just beyond the score in those 4 areas, and then kind of that it's like a short 30-minute call to discuss the high level stuff, but get more detailed. So more information on that to come. When that is released, it'll be on the that Bellshill website, Best Employers.
Excellent. Well, thank you. Well, I don't see any other questions in the chat. Um, so thank you so much, Taylor. And just a reminder for everyone, this webinar is recorded. It will be on our Patient Care Link website. We can put that link back in the chat for you again. And would encourage you to check out our events page. Where you can see other events that we have coming up, including our annual meeting in January, at the end of January. But scan those QR codes and check out all of our events, both virtual and in person. And we look forward to seeing you at future events. So Taylor, thank you so much. I hope you see some applications from Massachusetts, and we'll be in touch soon. Thank you.
Great. Thank you. Thanks, everybody.
Thank you, everyone. Have a great day.